Hello, my name is Samuel Gonzalez, and today I'm going to be presenting my presentation on the Flexor Digitorum Superficialis. Introduction to the Flexor Digitorum Superficialis. The Flexor Digitorum Superficialis is one of the two muscles that are involved in flexion in all of the four fingers. It is commonly seen as the largest flexor muscle in the forearm. It gets its name from a variety of things. As I think we previously seen, is that certain muscles get their name from individual actions or locations, or even sometimes just by what they control. This one kind of does it, but doing the similar thing, the action gives its name flexor. Digitorum refers to the fingers, and superficialis means that it's like on the top. It's not deep within it, as flexor digitorum profundus is actually a deeper muscle below that, and it's the second muscle that is involved in flexion for all the four fingers. Anatomy of the flexor digitorum superficialis. Like I stated before, it is superior to the flexor digitorum profundus. Due to its close location, they're commonly mistaken for one another. The flexor digitorum superficialis is commonly mistaken for the flexor digitorum profundus, and vice versa. One key difference, however, is that the flexor digitorum superficialis is actually more in charge, due to its split, is in charge of the flexion of each individual finger, while the flexor digitorum profundus is in charge more of all the fingers flexing at the same time. So if you were to flex each individual finger, you would be using the superficialis, flexor digitorum superficialis, while if you were to flex all at the same time, you would be using flexor digitorum brevis. It's kind of similar, but it's a key difference in all of them. Another difference from a lot of the anterior muscles of the forearm is that it originates from 3 different bones. And another thing is that it inserts to all the fingers, excluding the thumb, which is the only one that shares this, is the flexor digitorum profundus as well. Does that. Origin of the flexor digitorum superficialis. Like previously mentioned, the flexor digitorum superficialis is separated into 3 different bones, meaning it's originating from 3 different locations. I'll break down the origins really quickly. There's the medial epicondyle of the humerus, the ulnar medial head, and the upper 2/3 of the anterior radius. This is something that makes it different from the muscles that control the hand and wrist, meaning the flexion of the wrist and the flexion of the finger. Insertion of the flexor digitorum superficialis. The flexor digitorum inserts as its tendon splits and attaches to the palmar surface of 4 fingers. The insertion attaches to all the fingers excluding the thumb, due to the thumb having a different muscle that's in charge for its action. Like I said before, the split is actually a really big difference because it allows it more freedom to actually have more control in each finger. Action of the flexor digitorum superficialis. It is primarily involved in 2 main actions, and it gives a weak assist. I'm going to call it a weak assist because it's not one of the primary movers for that action, and it just gives you like a little bit of support. I'll break down the actions real quick. The actions are wrist flexion, finger flexion, and assist and weak elbow flexion. The reason why I said weak elbow flexion is because it does help out a little bit, but it's extremely weak. It's just because of its origin that it still has some connection to the elbow, but it's not really strong since not most of the muscle is from there. Everyday use of the flexor digitorum superficialis. It's important in all gripping and squeezing activities. This can mean something as easy as lifting a dumbbell that you previously did. If you're feeling pain or you're feeling weakness in that muscle, it can make it a lot more difficult and uncomfortable. Another way that we use it in everyday life is by typing. If you're typing in your computer, you're using that muscle. Another way, gripping. For example, if we're gripping the steering wheel while we drive, we're using that muscle as well. And if, like, for whatever reason it feels uncomfortable, it can lead to a lot of harm and discomfort. Biking, same thing. If we're biking and we're using the handlebars to steer ourselves, we're squeezing and gripping onto that, which means we're using that muscle. Another thing, grabbing grocery bags. Same concept as like with the lifting. It's just things that we do every day, which we don't really appreciate the muscle because it actually helps a lot of things. Like, for example, another way that we can use that muscle is by when we need to turn the door handle and we need to grab a hold of it and twist it and squeeze it to some extent. That's another way that we're using it. So it's just a muscle that we don't really appreciate as much. Exercises for the flexor digitorum superficialis. Exercises vary, but I will simplify them on which focus on the flexor digitorum superficialis and other actions which help contribute, in which they're not playing the primary role, but they're still helping out. These exercises consist of the wrist curl. When the wrist curl is basically you're just curling your wrist towards the anterior side, you're kind of flexing. It's kind of like a bicep curl, but you're focusing more on the flexion of just the wrist. Typically, you like to isolate it with having like on the edge of a table so that the gravity's falling down and you're flexing and you have more resistance. That's a good way to isolate that. Isolate all the muscles that are in charge of flexing your wrist. You can add on to it to add more resistance. You can add a resistance band. You can add a dumbbell. Another way that you can make it harder for yourself is to go to exhaustion, but keep going till you make sure that you're doing them correctly, but keep going till exhaustion or you feel that you can't do any more. And if you can't do any more, you have either the choice to stop if you feel that it's unsafe to do another one, or you can start doing half reps. It depends on your technique, because if you're doing half reps wrong or doing a repetition in general wrong, you're more likely to injure yourself than to cause any progress. Another way that you can strengthen the flexor digitorum superficialis is by using a DigiGripper, as that one focuses more on the individual flexion of each finger with some resistance. And then there's different types of resistance for these bands. For example, there's different colors which offer different levels of resistance. Another way is by using therapy putting foot, and that one you can just flex all your fingers together and it'll give you some resistance as the putty, which is similar to Play-Doh, but it's not Play-Doh, it's more medical than that. It provides some resistance and it's pretty good to help strengthen out, and it also gives you a nice workout to see if you have any fatigue and if you still feel weakness in your fingers and the strength of your fingers basically. Another way that this is not the primary mover, but it's a way that it's still being involved, is doing a bicep curl. You're flexing your wrist, even though it doesn't feel like it because you're focusing more on your bicep. When you're doing a bicep curl, in order for your hand not to go backwards, you're flexing your wrist. Your wrist is giving away some resistance. It's making sure that you're not bend it backwards, having a horrible technique that's more likely to injure your wrist, and it's giving it some stability. That was a long tangent. Sorry, professor. Stretches for the flexor digitorum superficialis. There's the wrist flexor stretch, and basically it's variations. The wrist flexor stage, you're in supination, you have your arm like pretty extended, and then you gently pull down on the tip of your fingers, and then you're pulling back so that you feel stretch on the anterior side and all your flexor muscles. You can do this in a variety of ways, and for whatever reasons you have a condition that prevents you from standing up and long enough to do this, you can do it sitting down. If for whatever reason your other hand is unable to put enough pressure, or maybe it's too sensitive, you can try it a different way, and that's by using the wall instead of your hand to put pressure on it. These are just different variations to see if anything's more beneficial. Common injuries for the flexor digitorum superficialis. There's carpal tunnel syndrome, muscle strain, sprained wrist, and other sport injuries. Some sport injuries can happen just like with anything. Like, for example, if you're playing football and you went to grab the ball and like you were trying to flex it and I guess you put too much pressure on it, that's one way that you can have a sprain. You can sprain your wrist, or you can have another type of injury happen to you. Some of the symptoms consist of numbness, pain, and weakness. Treatment for the flexor digitorum superficialis, flexor tendon surgery, since this muscle has a close correlation to the tendons. As we mentioned in the insertion, it splits into the tendons, and that's why it gets its individual control of all the fingers. Another way that we can treat flexor digitorum superficialis issues is massages or physical therapy. Physical therapy would like specialize on giving it specific exercises in order to strengthen and add more mobility to the muscle. Well, professor, this is the end of my presentation. And like I said before, when I got done with my final, even if I got 100 out of 100 in this one, I still wouldn't get an A. But it was cool. You're a pretty cool professor, so good luck on whatever you're doing. So yeah, peace out.